Conference over to Katie Dane, CEO of NCD Alliance. Please go ahead.
Good afternoon or good morning, everybody, and welcome to this NCD Alliance webinar on the 28th of November. Today we have a packed agenda with lots of different speakers from both the NCD Alliance team as well as WHO. So we'll jump straight in. Go to the next slide, please. Also, just as a reminder before we get into the content, that all of the PowerPoint slides will be available on the NCD Alliance website immediately after the call, as well as a recording of the webinar. So you're able to listen to it afterwards if you've missed a live webinar. So in terms of today, what we've got is a number of speakers from NCD Alliance, as well as a number of guest speakers from the WHO Department of Public Health and Environment. Next slide, please. The agenda is as follows. We will start off with Priya Knaisen from the NCD Alliance team in New York to run us through where we are in terms of preparations for the 2018 UN high-level meeting on NCDs that will be taking place in New York next year. Secondly, we will have an update from Elena Matska from the NCD Alliance team based in Geneva, who will walk us through the WHO General Programme of Work, which has just been discussed at a special session of the Executive Board in Geneva, a really important strategic directions of where WHO will be going in the future, including how NCDs will feature within that programme of work. Thirdly, Elena will also be talking to us about the Scaling Up for Nutrition Global Gathering, which happened recently in November, earlier this month. And then we'll move on to our guest speakers who are from the WHO Department of Public Health and Environment, who will be talking to us about the recent climate conference of the parties that took place in Bonn earlier this month, where health was a major feature within those deliberations. And then finally, we will be obviously filling you in terms of our up-and-coming Global NCD Alliance Forum that's taking place just in a couple of weeks in Sharjah in the UAE. And in addition, we will be giving you an overview of what's been happening around Our Views, Our Voices. That's an NCD Alliance initiative focused around patient engagement and empowerment. And then finally, we will be doing a very quick look to the future into 2018, early next year, of what we can expect in terms of global health and NCDs. So a lot to cover in a short space of time. So let's jump straight into the first agenda, which is the update on the UN high-level meeting on NCDs. Over to you, Priya.
Thanks very much, Katie. So I will go through an update, as Katie mentioned, on preparations for the third UN high-level meeting on NCDs. So this slide shows sort of where we've come from. So 2011 was the first high-level meeting on NCDs and was attended by heads of state and government and resulted in a political declaration. And this followed with a high-level meeting in 2014 to review the commitments from the first meeting in 2011. This one saw a drop in the level of attendance from heads of state and government to the ministerial level. The 2014 high-level meeting resulted in an outcome document that requested member states to come together to review those commitments in 2018 during the third high-level meeting on NCDs, which is fast approaching. And so in 2011, the really most important part was the adoption of the political declaration on NCDs, and this was the first UN declaration on NCDs recognizing NCDs as a international development challenge and not just a health challenge. So as mentioned, there were 34 heads of state and government in attendance. In the political declaration, we had the 4x4 definition, so the 4 main NCDs and their 4 risk factors, plus recognition of the comorbidities. It really called upon governments to not only just recognize that NCDs are a major global development challenge, but to really act on this with the adoption of 22 political commitments for governments to deliver on. The political declaration also had global assignments for WHO to develop a global monitoring framework for NCDs and establish a multi-sectoral partnership, which we now have in the global coordination mechanism. The high-level meeting also called for a review, another high-level meeting on NCDs in 2014. This one, again, had no heads of state or government in attendance. 6 ministers of health were at the HLM in New York in 2014. This meeting resulted in an outcome document that really represented a shift from the global focus to national focus, and calling on governments at the national level to implement time-bound commitments around national plans and targets for NCDs, the best buys for prevention as listed in WHO's Appendix 3, and health system strengthening. The outcome document also called for a third high-level meeting and review of these commitments in 2018. So this slide breaks down the participation at the heads of state and government level at the various high-level meetings on NCDs. Again, in 2011, there were 34 heads of state and government, and you can see these heads came from a fairly wide range of geographical representation. 2014, no heads but 6 ministers. And at the recently concluded WHO Global Conference on NCDs, there were 5 heads of state and government in attendance. So 2018 is really a big question mark in terms of what level of attendance we will see and how many heads will attend. We are doing quite a lot of advocacy along with other global partners to ensure that we have this high-level attendance at the third HLM. So the modalities of the high-level meeting set out the date, length, level of participation, and the program for the high-level meeting. This has not yet been decided and will be discussed and agreed upon early next year, most likely January of 2018. Earlier this year, NCD Alliance produced a process priorities document calling for a few elements that we would like to see in the modalities document for the NCD HLM. This includes that the NCD HLM will be held in September 2018 in New York alongside the HLM on TB for a period of 1 or 2 days. And the HLM must be at the highest political level and include civil society throughout the preparatory process and during the HLM itself. So this includes a civil society task force to really maximize the participation, a broad range of civil society stakeholders in the HLM and during the preparatory process, as well as a civil society hearing, during which civil society can provide their inputs on the outcome document for the HLM. We are also calling for the entire preparatory process, including outcome document negotiations, to be held in New York, and that's to ensure that the process remains a political process at the UN versus a technical process. And finally, calling for an outcome document that includes new time-bound commitments that hold governments to account and to deliver on those commitments. This slide, this is an overview of the preparatory process from WHO, showing both the formal process on the top half of the slide and WHO's informal preparatory process on the bottom half of the slide. The dates are subject to change, but this gives a brief overview of what is to come over the next sort of 9 to 10 months. So by the end of this year, WHO will submit its progress report on NCDs to the Secretary General, who will then publish a report and request President of the General Assembly to appoint 2 co-facilitators, which will then begin the preparatory process for the high-level meeting. So these co-facilitators are regionally representative, and they will guide member states through both the modalities negotiations and the intergovernmental negotiations to arrive at the outcome document of the high-level meeting itself. So as you can see, there are quite a lot of moving pieces. The top half is the preparatory process, again, at the UN here in New York, and the bottom half is WHO's supporting preparatory process from Geneva. So for September of next year, there are quite a lot of sort of competing priorities and meetings that we know of at this time. Both the TB and NCD communities are calling for their high-level meetings to be held in September, and that's, of course, in order to capitalize on the high-level presence during the UN General Assembly itself. Additionally, there is a Global Compact Summit on migration that may take place. And all this has to happen prior to the beginning of the General Assembly debate, which opens on Tuesday, the 25th of September. That means that we have Saturday, Sunday, Monday to fit in these three various high-level meetings. And of course, there might be some budgetary implications for holding a meeting on the weekend here in New York. So this brings us to some of the opportunities and challenges presented by the 2018 HLM. And it is the first review of NCDs since the adoption of the 2030 Agenda for Sustainable Development, and it really provides an opportunity to demonstrate how NCDs are integrated throughout the 2030 Agenda and the Sustainable Development Goals. We also see the HLM on TB as a chance to present a unified health civil society to member states and to highlight the synergies between TB and NCDs as well as the comorbidities that we know exist. Of course, along with that, there come a few challenges, especially of having two health-related HLMs. The TB HLM is the first time the UN is discussing TB. It could pull attention from the NCD HLM and result in some competition for media space, not only with the TB HLM, but also UNGA itself and any other meetings that the Secretary General might convene. In terms of looking ahead, the lack of resources within WHO is an ongoing challenge that will make it difficult for WHO to deliver on any new actions member states may call upon them to deliver, and of course as well as limited technical capacity in New York for health issues. And finally, the logistics of hosting a meeting in New York, especially during UNGA, is always a challenge, such as rooms for side events, the cost of hotel rooms, et cetera, as well as access to the UN for civil society. So, as many of you might have heard at the recently concluded WHO Global Conference on NCDs in Montevideo, Dr. Tedros convened a high-level commission on NCDs to be chaired by the President of Uruguay, Dr. Tabaré Vázquez, and Dr. Sanya Nishtar. And this is really to mobilize stakeholders around advocacy to reach SDG 3.4 on NCDs and to really make some recommendations as input towards the 2018 high-level meeting on NCDs. The full terms of reference are available on the slide there, and that hyperlink will be available after the webinar when we post the slides. So this is meant to be a high-level group of 20 persons, including representatives of government, UN agencies, civil society, the private sector, etc. And the composition of this should be announced in the coming days. The first report of this commission will be produced in May 2018, and any additional outputs will be shared in the upcoming weeks. In terms of our next steps for NCDA, we have recently concluded an online survey that was open from the 13th to the 24th of November to really understand how civil society views progress on NCDs since 2014 with regards in particular to country-level action, and also to help us as NCD civil society finalize and formulate our advocacy campaign priorities going into the 2018 high-level meeting. So these priorities, the survey is now closed and the results are being analyzed, and we will be sharing these initial advocacy priorities at our upcoming forum, which, as Katie mentioned, is in just a couple weeks now. Additionally, we will be doing quite a lot of advocacy with member states, both in Geneva and in New York, to really gain support for a high-level meeting in September 2018, again with participation at the heads of state, heads of government level, and of course pushing for, from the beginning, a strong action-oriented outcome document. And finally, the WHO Civil Society Working Group on NCDs. This was also convened by Dr. Tedros right around the Montevideo Conference on NCDs, and this is to advise the Director General on involvement and participation of civil society throughout the HLM process. This is also to help develop a business case for the President of the General Assembly to establish a UN Civil Society Task Force. And the Civil Society Task Force is something that actually previous high-level meetings on HIV and AIDS have had very often. Every time they've had a high-level meeting, they have a civil society task force, and that really helps ensure that people's voices are included in the high-level meeting. So this is something that we are calling for as well, and another avenue through which we will be advocating for this. So the terms of reference are linked there, as well as more information, and this will be chaired by the new ADG for NCDs, Dr. Svetlana Axelrod, and Katie Dane, CEO of the NCD Alliance. So I will stop there and pass it back to you, Katie.
Thanks very much, Priya, for that great presentation. Good to hear about the updates around the UN high-level meeting. And as Priya outlined, it's all about the process at the moment, which might sound a little bit in the weeds and not particularly important, but actually, having been through 2 high-level meetings for NCDs in the past, we know that the process and the modalities for these kind of meetings are as important as the actual negotiations around the outcome document, because unless you have really clear support from governments that they want it to be at the highest political level, that they want it to include civil society, that they want it to focus on certain themes for the roundtables, that really does guide the whole process and the whole meeting and the potential for outcomes, strong outcomes. So these things are really important for the next few months. Our advocacy as a collective around the process is going to be really key. So for any of you that are speaking to your governments, whether it's in your capitals or with your missions in Geneva or New York, we really encourage you to be looking at the NCD Alliance's process priorities for the high-level meeting, and particularly, as Priya was saying, to be really encouraging governments to make sure that the whole deliberations for the high-level meeting take place in New York rather than Geneva. Because otherwise it's going to become a very technical meeting when we obviously, as Priya said, want it to be a high-level political meeting. So thank you very much, Priya, for that update. Let's keep moving, and as has been typed in the chat facility, for those who do want to ask a question, you can type it in the chat facility on your online interface, and we will answer them periodically throughout the webinar. So now let's move on to our next presentation, which is from Elena Matska from NCDA in Geneva, to talk us through some updates on the WHO General Program of Work. Elena, over to you.
Thank you very much, Katie, and hello everyone. As you probably are aware, we are currently in the middle of a consultative process on the draft 13th General Program of Work. This process began officially or publicly in August with a concept note open for public consultation, and then the draft General Program of Work that was published in November again open for public consultation together with a draft impact framework. This 13th Global General Program of Work will guide the work of WHO for the period 2019-2023 and is positioned to have is presented to have the ambition to deliver more impact through a change in both priority setting and strategic and organizational shifts. As you can see on the slide, the mission is framed around promoting health, keep the world safe, and serve the vulnerable. And the GPW is framed around the so-called triple billion targets of health coverage, 1 billion more people with health coverage, health emergencies, 1 billion more people made safer, and health priorities, 1 billion lives improved. NCDs sit both within the health coverage priority in UHC and health system strengthening, and more specifically and explicitly in the health priorities, 1 billion lives improved. We consider the current draft a significant improvement from the concept note that we saw in August, with much stronger recognition of the need to address NCDs as a key priority within this program of work. The strategic shifts that are envisioned are framed around stepping up global leadership to raise global awareness and leverage domestic investment, much more of an advocacy role here for WHO to champion health across sectors and the highest political level. The this very strong focus on driving impact at the country level to leverage WHO's expertise and across governance, financing, health workforce, access to medicines, gender equity rights, etc., in a way that is tailored to country needs. And WHO will be taking different approaches to delivering this impact in country in different countries according to their health needs and their health systems needs. We're being assured that WHO's normative work will still remain central to what the organization does, and that this shift to country level action doesn't weaken the normative work of the organization. Next slide, please. There's also 4 so-called flagship programs, including one on NCDs and mental health, one on climate change, one on human capital, and one on antimicrobial resistance. These, I understand, are still being very much fleshed out and need much more additional detail and clarification. So far, the NCD flagship program is framed around really mobilizing high-level political commitment and action and promoting technical assistance packages to deliver on these commitments and implementation at the country level around a set of targets for NCDs. Next slide, please. Last week, the WHO convened a special session of the Executive Board, which very much was framed as a listening session to hear member state feedback on GPW 13 and to share more detail on the Director General's vision and to open space for discussion. In his address to the board, Dr. Tedros highlighted what he sees as the 10 early achievements since taking office in early July, including appointing a diverse senior leadership team with more women than men for the first time in the history of the organization. He also referenced the engagement on NCDs in these first few months, including the Montevideo conference and the setup of a high-level commission on NCDs, and he very much highlighted that WHO has begun to step up its political engagement across a variety of international fora, including the G20, the G7 Health Ministers meeting, COP23, etc. And I would say that throughout the meeting, it's very clear that Tedros is much more of a politician rather than a technical leader, and doesn't shy away from this type of high-level advocacy for health. Among the key priorities that he highlighted, NCDs figured high up on the agenda, again also addressing the commercial determinants of this epidemic, as he's done now quite vocally, and urging for more action. He reiterated a variety of the priorities of the GPW, including its focus on the poorest and more vulnerable, more focus on the country and regional level, making normative work more focused on impact. But he also highlighted that he very much understands that WHO can do everything, and that he is proactively setting up active partnerships, going beyond potential competition with other global health actors. Next slide, please. So as I said, the session was very much, WHO, the Secretariat was very much in listening mode. There wasn't a line-by-line negotiation. It was a rather general discussion with decisions to be taking next year. I would say that the tone of discussion was rather blunt and straightforward. Tedros urged countries to provide WHO with more trust, and also really the resources to be able to do its work. For example, calling for the flexible use of financial contributions from member states and much greater autonomy for the WHO Secretariat to be able to deliver on its work. Some of the member state comments most of it were generally very supportive, overall support for the strategic priorities and the focus on outcome and impact, reiterating the importance of data, evidence, and science. A lot of questions around how the triple billion targets were calculated, more detail requested on what it will mean for WHO to be more operational and focused on country level. It was a lot more focused these days at the executive board level on political and commercial determinants. The language here shifting quite a lot, with I at least cannot remember these commercial determinants being referenced as often as these days. Also calling for maintaining focus on public health, and a lot of questions obviously around financial implications, given that WHO hasn't shared its investment framework and the financing piece of this conversation. Next slide, please. A lot of countries, and this is just a short list of countries, called for more focus on prevention and health promotion, taking a life course approach. Quite a number of member states and society organizations that also highlighted the absence of an adequate focus on aging in the current draft, and the importance of integrating that in drafts to come. I understand that responding to some comments received, there is now an additional indicator in WHO's impact framework around sodium reduction. And one of the comments that we ourselves made, and a variety of other society organizations made, is that we felt there's not sufficient focus on health system strengthening for NCDs under the UHC 1 billion targets, that first target. May I see the next slide, please? In the impact framework, you can see the indicators for the UHC priority, and you can see at the very bottom there that the focus here for NCDs is around reducing the prevalence of raised blood pressure by 20% and halting the rise of prevalence of diabetes. And we propose that in drafts for moving forward, there should be the integration of one of the health systems targets within the NCD global monitoring framework, such as the availability of essential NCD medicines and technologies. Next slide, please. So in terms of the timeline moving forward, on 5th of January, WHO will publish an updated a draft of the GPW, and also an updated impact framework. There's already a new version uploaded during the special session, and this will be published together with a technical report on the triple billion target. Mid-January, WHO is planning to host a mission briefing on its resource mobilization strategy. And then obviously 22nd to 27th of January, the discussions will continue at the executive board with a planned adoption of the GPW in May. At the bottom of the slide, there is a couple more links if you want to read up on what happened at the executive board. And I'll pause here. Okay.
Thanks, Elena. We haven't got any questions coming in at this point, but let me just kind of ask you a question before we move on to the next part of the agenda. You mentioned in part of your presentation that obviously aging had been not mentioned at all in the GPW, and I think that came out very strongly in the consultation responses. And obviously linked to that, there was absolutely no mention of neurological disorders such as dementia. What are the opportunities going forward for civil society organisations to input in? Obviously it's being adopted at WHA in May. Are there going to be specific opportunities for us as civil society to be making our points further?
Yeah, I mean, I think the Director General made very clear that this is very much an ongoing process, that we're still at the beginning of the conversation. The Executive Board will be a critical advocacy opportunity. There may be another similar meeting to the special session in order to have more space to discuss the GPW in greater detail. And I think for civil society, there's different avenues of making their voice heard. I definitely encourage talking to member states and having member states be the bearer, so to say, of strong messaging around points that we feel are neglected, but also certainly reaching out to the Director General or his team directly. I mean, he's made very clear that he is very open to receiving feedback and comments. He's very, very active on Twitter. I mean, this Director General essentially lives on Twitter, so using those different modalities, so to say, to get messaging across and focusing on the time between now and the executive board is certainly important.
Thanks, Elena. And just one other question from me. I mean, I think one of the questions that we grapple with is obviously how will this GPW really translate into resource allocation inside WHO? I mean, it's fantastic to see that NCDs are being recognized as a potential flagship initiative, which shows a level of priority perhaps. But we also know that NCDs have been the most underfunded part of WHO's program over the years. So how do you kind of see it panning out in terms of actual resource allocation for the issues?
I find it really difficult to project that, since we haven't seen anything around how WHO will approach this question. But I find it encouraging to hear a very strong messaging from the Director General on the need for flexible use of membership fees, etc. And I think that it's certainly very important for the NCD community to really support these calls to member states to be more flexible around their funding, because it's counterproductive to delivering WHO's agenda to have a large amount of restricted funds and a very, very small amount of flexible funding. So championing approaches by countries like Norway and Sweden that have a more flexible approach to their contributions to WHO is certainly important, and close monitoring of how the discussions on financing will be progressing is certainly as important as making sure that the GPW includes the right priorities.
Mm-hmm. Great. Thanks, Elena. Let's keep moving in the interest of time. So if you want to carry on with the Scaling Up Nutrition update as well. Thanks.
Great. Could I have the next slide? Ready? Great. So for those of you that are not familiar with the Scaling Up for Nutrition movement, it's a movement led by governments. There's about 60 sun countries right now, if I'm not mistaken, and it's uniting different networks, civil society, UN agencies, donors, businesses, and researchers in a collective effort to improve nutrition. The movement was launched in 2010. It was traditionally focused on undernutrition. Its new strategy, however, seeks to address malnutrition in all its forms, including overweight, obesity, and NCDs. Among the targets that it's focused on delivering are the WHO nutrition targets and relevant targets from the NCD Global Monitoring Framework. So you can see here no increase in childhood overweight and no increase in overweight, obesity, and diabetes included in the targets of the SUN movement. Next slide, please. So to see how the SUN movement is implementing this new strategy, we attended the SUN Movement Global Gathering, which was for the first time hosted by a SUN country, Ivory Coast, convening all of the SUN networks for a big gathering to exchange good practice and discuss ways forward, but also to celebrate successes. There's a variety of high-level speakers, including the President of Ivory Coast, the former President of Tanzania, the First Lady of Tahiti, and also the President sorry, not Tahiti, Haiti, that's an embarrassing mistake, and the president of the African Development Bank, who attended the entire first day and was very, very present and very vocal on having to address malnutrition in all its forms, including overweight and obesity in Africa. The global gathering obviously still had a strong focus on accelerating action and increased investment to fight stunting and wasting, but also discuss these new priorities of addressing overweight and obesity and moving towards more sustainable food system, mitigating climate change, etc. It saw the launch of the 2017 Global Nutrition Report, and many of the speakers really highlighted how important it was to begin addressing overweight and obesity now, as otherwise investments in nutrition will be lost. Next slide, please. The Global Nutrition Report has a very, very clear message. Almost every country faces several malnutrition burdens in many cases. There's an interesting graphic here that shows the very large number of countries that, for example, have double burdens with overweight and anemia existing, coexisting, stunting and overweight coexisting, or stunting and anemia coexisting, and since this very, very clear message that no country is not affected by malnutrition. Next slide. So why does the Sun movement matter for NCDs? I'm seeing it really as one of the global platforms for promoting overweight and obesity and NCDs within the SDGs. It has cultivated a number of high-level champions at head of state and head of government level across the UN system, etc., and is an important partner in raising awareness for the 2018 high-level meeting. The Sun Lead Group, for example, includes familiar names such as Sanja Nistra and Gunhild Sterdalen, who are certainly waving the flag for more action on NCDs. There's great potential of alliance building at the country level between Sun civil society and NCD alliances, championing integrated action for food and nutrition at the country level, which we're already beginning to facilitate now after this global gathering. And it's also a platform for investment in all forms of malnutrition, and we're beginning to see more countries committing to address both undernutrition and overweight and obesity. To wrap up, though, I think the main reflection from the global gathering is that, yes, there's overwhelming recognition of the problem of malnutrition in all its forms, the need to address overweight and obesity simultaneously with addressing undernutrition, but we really still need to move from that acknowledgement of the problem to promoting its solution. At the gathering, it struck me that there's still a very low level of literacy with regard to evidence-based policy solutions for overweight, obesity, and NCDs. And moving forward, we as the NCD community certainly have a role to play in terms of sharing good practice, of sharing evidence, working together with the Sun movement on messaging, advocacy, and sharing information, but also voicing constructive criticism where it's needed, for example, with regards to some of the members of the Sun Business Network or any potential conflict of interest that could arise there. Thank you very much.
Excellent. Thanks, Elena, for those presentations, and it's really encouraging to see progress being made in terms of building these synergies with other areas of the sustainable development community. Obviously, this is one of the NCD Alliance's approaches to advocacy now that we're in the era of the sustainable development goals and linking NCDs to these other areas of sustainable development. So fantastic to see the undernutrition community recognizing the importance of obesity and NCDs, and obviously the need to do a lot more around kind of double duty actions and co-benefit solutions. Thanks very much, Elena. I think we'll move on to the next presentation because we haven't got many questions coming in. So I'm really pleased to be able to introduce our guest speakers for this webinar. We have on the phone Elena Villalobos and Annette Prusistun from the WHO Department of Public Health and Environment, who will be speaking to us about the recent climate conference of the parties that took place in Bonn. And just to let you know that in the chat facility at the bottom of your screen, we have included a link for a video, which will be, so during the presentation, our WHO colleagues will be mentioning this video. So if you could click on it when they're talking about it, then you can watch it online. It might take a little bit of time to kind of download. So just to flag that before we hand over. So over to you, WHO colleagues, on COP and NCDs and environmental health.
Hello, and we decided that for the same price of having Elena Villalobos and Annette Cruz, you can have as well a third colleague. So it's Maria Neira speaking. So good afternoon, all of you. You see, we are not very cost efficient because we are three here, but we thought that this event was very important. So we decided that all of us will be joined. So they are here with me. And I'm sure that I hope that we will be able to answer any question you might have by being together. Let me then move on what is our recollection from COP. This year, let me tell you something, this year, in my opinion, or at least in the opinion of many of us who have been trying to promote health for a long time at the COP, I think it has been very transformational because finally, I think health is the argument that everyone is using in many events to promote more action on tackling the causes of climate change. And this is not because it was not from the beginning. Health was from the beginning on the narrative of the climate change, but it was very much a lip service, probably, and not really considering even that because of not tackling the causes of climate change, you were causing major health problems, and those health problems will have even a very important economic cost of our society as well. I think this year has been a complete change. It has been very difficult to make the linkages for people between climate change and health, but now we are linking it very much to air pollution, for instance, and other exposure to environmental risk factors, and this is what has caused this very important change and transformation in all of this agenda. And in fact, until now, what we were saying is that when I was referring to this lip service is that in the past, it's true that many people have been talking about climate change and health, and we call it even the inconvenient truths for health in the climate policy, because everybody has been mentioning in the agreement health. There have been more than 300 side events focusing on health. There have been, many proposals that have been submitted to the GEF or to the other funds where health has been mentioned. But the question and the answer to those 4 questions that you should have in front of you is that, in fact, the answer is just, let me see if it's in here, it's just a 1. I mean, only 1% of the funds that were dedicated to, of the proposals that were submitted to the to the Global Environmental Fund, only 1% of the resources were allocated to health. So, talking and lip service, yes, but only now I think the citizens and then the policymakers are starting to link pollution and health and exposure to health to environmental risk factors and to the climate change. And they are starting now to recognize what we have been saying for a long time, that in fact the Paris Agreement can be one of the most ambitious public health treaties of this century, provided, of course, the countries execute what they have committed to do under the nationally determined contributions. So why this year was different? Because we tried to do our messages in a different way. instead of talking about how climate change is affecting our health, we were talking about what are the health co-benefits that you can obtain if you tackle the causes of climate change. And we linked that very much to air pollution. And as you know, air pollution is now generating a lot of attention. And the most important is that people link very easily exposure to air pollution to health consequences. Let me go then to the outcomes of this COP23. We had a high-level event when we were trying to focus on health and climate change, having Governor Schwarzenegger help us a little bit on getting a lot of advocacy and awareness raising around this event. Our new Director General was there, and the President of the COP23, the President of Prime Minister of Fiji, and Patricia Espinosa. So we have this as a high-level presidency event. And then I think it was very important to include health on a health decision, on a COP decision for keeping this dialogue. And as you probably heard about it as well, we launched at this event a special initiative looking at small island developing states, and this was one of the outcomes of this side event. But let me now take you to the linkages between NCDs and public health and environment. I'm sure you heard this before. This is from one of our most important reports where we were trying to estimate the burden of diseases linked to exposure to environmental risk factors. And as you can see, 12.6 million deaths are occurring every year due to exposure of those environmental risk factors. So this is the big picture, and I think this is from where we need to link NCDs, climate change, air pollution, and health. This is the big argument that we can use. We are not talking about polar bears. We are not talking about glaciers melting or the planet and the future of generations. We are talking about our health today with 12.6 million deaths that could be avoided if we take actions and we put in place interventions that in many instances that are the same ones that we need to put in place if we want to reduce climate change and air pollution, for instance. When you look at the top 10 causes of death from the environment, people tend to think that we are talking about diarrheal diseases, for instance, but when you tell them that the number 1 is stroke, the number 2 is ischemic heart disease, the number 4 is cancer, and the number 5 is chronic respiratory diseases, then we react and saying why we were not linking this to the non-communicable diseases agenda before. Because this is clearly 8.2 million out of those 12.6 that I was referring before, caused by the environment, are due to non-communicable diseases. And having as number 1 stroke and as a number 2 ischemic heart disease tells us a lot on how we need to be united in this battle, how many opportunities we have on joining forces, and maybe this is the main conclusion of all our discussions here is that we need to join forces. What we are doing on tackling the environment, removing environmental risk factors, in fact, we are somehow contributing to help you to reduce incidence and prevalence of non-communicable diseases and death from non-communicable diseases. If you see this slide with those columns, I mean, Annette can explain you much better than me. Actually, I will pass it to Annette because she did this graphic, so she will be the one who can explain it better than me.
Yes, hello. So what you see here are the main risk factors for NCDs. And on the left side, we have the 2 bars on household air pollution and ambient air pollution. That you can see that together they are in the same range as the other big risk factor to NCDs, which is smoking. Now, when you look at the trends, you can see that and these are the trends of the fractions of NCDs attributable to the risk factors, not the total deaths of NCDs. So you can see that the only 2 going up are ambient air pollution and low physical activity, which are very closely related to the environment. So I pass you back, Maria.
Thank you, Annette. You have the privilege to having Annette, who is the author of this graphic, so I think it's important. No need to insist on that. I mean, air pollution affects nearly all of us, and if you are following the material that WHO is producing in this sense, our estimates tell us that an estimated 6.5 million premature deaths are associated with air pollution, were associated to air pollution in 2012, and this represents almost 12% of all global deaths. And in fact, that means something which is totally unacceptable. It means that 92% of people worldwide do not breathe safe air. And unless we do something about that, you will have major difficulties of producing good results on the NCDs agenda, because air pollution is one of the biggest, the most important risk factors for NCDs, and it's maybe not officially so well recognized, but as I say, we need to join forces and all of that. I think here you will have a video, if I'm not wrong. Oh, you should click it on the...
Video. Let's maybe go to the end and then we have the video.
Yeah. Can you click on the brief live? No, it's not that one. Okay, let's keep on, and then we can go to the...
It's on this one, yeah.
Oh, okay. Can you click and see whether it works, the video?
People have received...
People will have...
There's a link in the chat feature to the left of the screen, and the link is active there. It's not active on the slides. So everyone and every participant needs to click that YouTube link that Jessica Beakley posted at the beginning of the webinar.
Right. Okay, so maybe we don't need to see it now. I will invite all of you to see it once this webinar finishes, because it takes very little, and I think it's very, very powerful, and please use it anytime you have the opportunity and you think it's relevant. The slide I'm showing now refers to indoor air pollution. As you know, around 3 billion people still cook and heat or light their homes using open fires or very simple stoves, burning biomass and coal, so definitely contributing to this death by air pollution. And in fact, the indoor air pollution is responsible for 4.3 million deaths every year caused to this exposure to this smoke and cooking fuels. But as I say, air pollution is probably one of the invisible killers, but it's definitely the one that is very, very much related to your agenda. I mean, 36% of deaths from lung cancer are linked to exposure to air pollution, 34 for stroke, and 27 from deaths from heart disease. I will invite you all to use this graphic and please incorporate it on any document that you are producing under the NCD Alliance. This is very powerful. I think it's very visible. It's based clearly on scientific evidence, and this is where, if we join forces, we can start to produce massive results very soon. As you probably know, the moment we are talking now, there is in New Delhi, the level of pollution of PM 2.5 reached 900 micrograms per cubic meter, while WHO recommends 10, and this is not at the expenses only of being unpleasant for the community. This is the price is paid by our lungs, by our brain, and by our heart. So this is something that we need to pass this message around. We are doing our best to promote interventions to reduce exposure to air pollution, and then we need to be able to quantify the benefits that this will generate for the NCDs agenda. I hope by now you all have received this document, the Preventing Non-Communicable Diseases by Reducing Environmental Risk Factors. again, an alliance that maybe you don't know that exists, but this is the alliance between the NCDs and the public health and environmental community. And this is where we can find a lot of solutions and opportunity. And one of the big opportunities that we are very much promoting now is there are interventions at the urban environment, and by promoting clean access to clean energy, a more efficient use of energy resources at the house level, in the building and the built environment, a more sustainable public transport system, and waste management. The case of New Delhi, for instance, that one of the sources of pollution in New Delhi on an acute way last week is because they were burning agricultural crop waste, incinerating that, and that was generating part of this. It was an important source of pollution that in New Delhi. So the second opportunity is, as I say, the Paris Agreement. If we look at the national determined contributions of the countries, and they are all published and publicly available and on a very transparent way, you can challenge your own government and say, well, if you execute what you have committed as a country to do, there will be massive benefits for health, and particularly for the NCDs, for reducing non-communicable diseases. The Green Climate Fund might be an opportunity as well for accessing funds, although at the moment it's a very complex mechanism that it will be very difficult to engage on it. Clearly, the opportunity as well is under the Sustainable Development Goals, but not only or not exclusively the SDG 3. I think on the case of health and environment, and on your case on non-communicable diseases, unless we work and we influence and we promote clean, access to clean fuels and clean sources of energy, clean and sustainable sources of energy, we will not be able to tackle the causes of climate change, but not able to tackle the causes of air pollution, and therefore not able to reduce non-communicable diseases. In addition to that, obviously, promoting a sustainable transport system is not just about reducing air pollution. It's about being able as well to promote a less sedentary lifestyle, a more active lifestyle, and being able to walk or to cycle in the cities, and therefore going against this sedentary lifestyle that contributes, lack of physical activity that contributes. So 11 is extremely relevant as well. The way our cities and our urban environments will be developing needs to be very much influenced by us, because it will be fundamental to tackle those causes of climate change and air pollution, and therefore having good results for health. 12 and 13 as well, no doubt that they will provide a good opportunity. And the last one, I think, is something that we all need to pass this message around, is about primary prevention. Do much more on primary prevention. So it's not just treating people who have diabetes, which of course they need to be treated, detecting them on time, and making sure that the treatments are available and affordable. But it's as well that the opportunity for these people for not living on an obesogenic environment, and for that you need to have good interventions for urban planning, healthy urban planning, and you need to work with the energy sector, you need to work with the agricultural sector, and I think once again this is a call for joining forces between the NCDs and the public health and environmental community, because we have a lot to offer, and if we quantify on a cross-reference way your results to our results, I think we will multiply the benefits for all of us, and we will motivate more action probably. So I think this is the last one I wanted to show you, and now of course open for questions and hopefully answers as well, if we are able for that. Thank you. Over.
Thanks very much, Maria, for joining us and for that great presentation, really kind of reinforcing the strong evidence of the links between environment and NCDs, and also sharing some really useful tools and solutions for how we can collaborate more in terms of environment, public health, and the NCD community. While we're waiting for a couple of questions to come in, I have been scribbling down my own questions. So if you have time, I'll shoot these over to you straight away. So my first question is, obviously a lot of the NCD community, as we heard earlier in this webinar, is now focusing on the UN high-level meeting on NCDs next year in 2018. And one of the issues that's being discussed by many people in the NCD community, and no doubt you've been very involved in these discussions, is, should we look beyond the traditional 4x4 framing of NCDs? Obviously the 4 major diseases, the 4 risk factors that provide the framework for what WHO has focused on largely around NCDs to date. So my question to you is, would you be supporting a kind of expansion of the 4x4? And obviously we've seen this in certain regions like the WHO Sierra region taking on air pollution as one of the specific targets and recognizing it as a key risk factor for NCDs. Are you supportive of that at the global level, and should we be thinking about that for our advocacy for the high-level meeting?
Well, I think it's something that is not for discussion, the fact that air pollution is becoming one of the biggest risk factors for NCDs. And this is, I don't know whether the answer is to, instead of 4x4, having a 5x4 or 5x10, or I don't think it's a question of changing slogans. It's just a question of recognizing the very critical importance that environmental risk factors, and particularly air pollution, is playing, having somewhere a recognition of that, and then creating this bridge to the community that is already working on that, because this is my point. We might not be under the 4x4, but believe me, we are already working on it, and all the work we are doing somehow will benefit the NCDs agenda. So having a session about action to reduce air pollution and how this is contributing to the reduction of NCDs could be something more attractive. So it's not a question of changing a frame that it might be useful or not, but clearly recognizing there are another community that is already working on environmental risk factors and trying to reduce those environmental risk factors, and can be a massive pillar of your work. So you don't need to include all the environmental work under NCDs. And the environmental work is going on not only for NCDs. We reduce communicable diseases as well, or we have other health benefits, but recognizing this important risk factor first. Second, that the interventions can be planned together, and third, how can we quantify and collect the health benefits that we are already collecting and using it as well for NCDs, and then generating more action. So I see at least a big part of your high-level event dedicated to interventions that are contributing to reduce environmental risk exposure, and then contributing to the reduction of NCDs.
Great, thank you for that. And I guess my second question is a rather big question, but something that we often get asked is, which are the countries that are doing well in terms of NCDs more broadly? But obviously to you, I'm really interested to kind of hear from you, which countries do you think are kind of leading the way on reducing the environmental risk factors for NCDs that you're aware of?
Well, let me start with something very provocative. If you ask me something absolutely transformational that is happening at the moment, I will tell you that China is taking incredible measures. China is one of the most polluted countries, don't take me wrong. I mean, it's a country where the levels of air pollution at the moment are very, very high, but it's true as well that they have declared a national priority to fight against air pollution. And by doing so, they are already closing down some and they are moving into a low-carbon economy, and sometimes even going as far as phasing out of the use of coal for electricity, on the power plants. And that's very strong because they are not yet going down with the trends on air pollution, but they are stable. So they are not anymore increasing on the levels of air pollution. They managed to make it stable, and I'm sure that they will produce more results. So this is in terms of obviously where the surprise, I would say, will come from. And maybe it will be very interesting to look at how this will be affecting, on a positive way, NCDs, because we might be ready to start to see a reduction in certain type of cancer, on chronic respiratory diseases, and maybe even heart attacks and stroke. Not immediately, but probably we will be able to detect that quite soon if the measures are very strong. Obviously, if you want the best model in terms of tackling environmental risk factors, I would say the Scandinavian countries. But I think you have even in other countries like Chile, for instance, now is moving in something where they are very much on environmental interventions, and their economy continues to grow without destroying the environment and without polluting and destroying the health of the people. So there are good examples in many places, and we can start on presenting that, improving that. You can reduce the use of fossil fuels, reduce pollution, still keep with your economic growth, and produce a lot of health benefits, including obviously most of them related to NCDs. Over.
Great, thank you. And then one final question we've had from Beatrice Champagne from the Healthy Latin America Coalition. Beatrice is asking about the new Bloomberg Partnership for Healthy Cities initiative, and how is this relating to environmental issues?
As far as I know, this is very much related to tobacco and maybe a little bit of physical activity, but I don't think it has been designed to look at environmental risk factors. But there are many other initiatives, and I hope we will be able to include under the Bloomberg initiative more interventions that are targeted to reduce air pollution. But there are many initiatives and movements with mayors that we are working on it, and I think if you have a look at this Breathe Life campaign, you will see that many big cities around the world, like Paris or London or Oslo or in Chile as well, and Santiago de Chile, and many others are joining in this Breathe Life campaign. And obviously, the mayors are the ones that can produce a lot of benefit from that. Let me tell you as well that when recently was a big meeting at the Vatican City with a lot of Nobel Prizes and very influential people, including Governor Jerry Brown from California, that, as you know, California is one of those examples of proving that you can develop economically without destroying the environment and all of that in the name of health. So Jeffrey Sachs was there as well. I have the privilege to be there. But my point is that on the declaration, when we talked about NCDs, they were all absolutely shocked that air pollution, for instance, was not mentioned on the NCD's plan of action. And I think this is something that we need to change, because today the world is terrified about air pollution. It's very much on the political agenda. It's very much affecting economies and, of course, the health of the people. And it's quite surprising that there is no mention of that as one of the big risk factors or that needs to be considered or as a risk for NCDs.
Thanks, Maria. I think we're going to have to move on to the next agenda item. But thank you very much for joining the webinar, and to Elena and Annette as well for joining as well. Thank you for that great presentation.
Thank you. Pleasure. Thanks for inviting us. Bye.
Thank you.
Bye.
Bye. So moving on to our next agenda item, where we're going now to the Global NCD Alliance Forum, which is happening in just under 2 weeks' time now. So over to Cristina Parsons-Perez from the NCD Alliance team in London for an update on the forum.
Thank you, Katie. Hello, everybody. Could I ask my colleague to pass to the next slide, please? As Katie said, I'll be sharing with you today about the plans for the Global NCD Alliance Forum, which will be taking place 9th to the 11th of December in Sharjah, United Arab Emirates. It will take place hot on the heels of the World Diabetes Congress that will take place in beginning of December in Abu Dhabi. The theme of the Global NCD Alliance Forum is Stepping the Pace on NCDs, Making 2018 Count. And this is the second Global NCD Alliance Forum. I'm sure that many of those on the webinar today were in attendance at the 2015 Global NCD Alliance Forum. Next slide, please. The forum is hosted by the NCD Alliance in collaboration with local host organization Friends of Cancer Patients. It is possible thanks to the patronage of Her Highness, the Sheikha of Sharjah, who is the founder and royal patron of Friends of Cancer Patients, as well as the ambassador for the childhood cancer for UICC. As I said, the first forum took place in 2015, and this was the first time that NCD Civil Society was convened. And we brought together the network of national and regional NCD alliances. The forum in 2017 is again convening this network, but this is the second time that the network is coming together. And so, whereas in the first forum the focus really was on networking and getting to know each other and really understanding more who was a part of this NCD Civil Society community, the forum in 2017 is really going to zoom into what the community is doing and what it can be doing as we are looking ahead towards the UN 2018 high-level meeting on NCDs. The forum is the only global NCD civil society convening, and the focus is on advocacy and, of course, in capacity development as well. Next slide, please. We are looking at bringing together approximately 350 delegates from 68 countries. The real focus and target audience of the forum is NCD Civil Society, and at the heart of that are national and regional NCD alliances from across the world. We're bringing representatives from 49 different NCD alliances. One particular aspect of interest and of importance in the forum is the meaningful involvement of youth and people living with NCDs. And so we are making sure that 10% of our target audience is composed of this specific audience. We have a very rich program planned with 3 plenaries, opening and closing ceremonies, 3 workshop streams, 15 workshops over the course of 3 days. The forum will close with the Sharjah Awards for Excellence in NCD Civil Society Action, where we are looking at awarding those case studies that really embody the best of what is being done by NCD Civil Society in furthering civil society roles and also in furthering the Sharjah Declaration that was produced at the 2015 Global NCD Alliance Forum. To recap, the Sharjah Declaration is an expression of commitment of NCD Civil Society towards accelerating action on NCDs, and the forum is attended by invitation only. Next slide, please. So the objectives of the forum are really to further that Sharjah Declaration, that commitment of civil society, facilitating advocacy campaign planning towards the 2018 UN high-level meeting. At the heart of the forum and its uniqueness is the convening of the civil society community to share experiences and lessons learned and cross and transcend borders. We are actively looking at promoting that engagement of youth and people living with NCDs in the NCD movement, and we will be launching the advocacy agenda of people living with NCDs, more of that in a second. We're looking at strengthening the capacity of civil society in attendance and really building momentum and priming the NCD community towards the 2018 specific opportunity at hand. The timing of the forum is no coincidence. We're looking at holding this really at the tail end of 2017, so that we're looking forward ahead into 2018 as the campaign work will grow, as we're looking at impacting that 2018 UN high-level meeting. Next slide, please. You will note that the forum's program is arranged along three streams. The first one on advocating for NCD prevention and control, and this one really dives into the campaign priorities and the content of the priority areas to further for that 2018 UN high-level meeting. So those advocacy priorities. Stream 2 is looking at really building bridges and exploring those cross-cutting areas between NCDs and other areas in the Sustainable Development Agenda. So Stream 2 is breaking down silos and building synergies in the SDG era. So really kind of tying in actually to discussions that were just had in this webinar, for instance, looking at other communities in that sustainable development space that really relate and link to NCDs. And then finally, Stream 3 is about how the movement needs to work and to mobilize going forward. So this is really about the nuts and bolts of networks and those tools and strategies needed to be effective advocates. Next slide, please. And so a preliminary program can be found online at the NCD Alliance website. But as discussed, the Global NCD Alliance Forum takes place over the course of 3 days. What is particularly unique to this iteration of the forum is that on the first day, before the opening ceremony, we will count with a substantial amount of time that will be allocated towards advocacy planning meetings. And we are anticipating that these are attended by civil society delegates only, and we'll really be looking at this mobilization and opportunities at a regional level. So how does the movement cross borders? What are some of the champion countries as we're looking towards the 2018 UN high-level meeting, and what are some key advocacy entry points for this campaign specifically? We have a fantastic program lined up, and we have some excellent speakers at the forum. I'm just going to highlight a few, but we're expecting the President of Sri Lanka, Matripala Sirisena, also, of course, His Highness, the Sheikh of Sharjah. We'll be expecting Dr. Sanya Nishtar, who will be giving a keynote, and of course, she's a co-chair for the WHO High-Level Commission on NCDs, Princess Dina Mered, and a series of other notable speakers, panelists, and keynotes. Next slide, please. From a communications perspective, there's quite a lot happening at the forum. As mentioned, we will be launching the advocacy agenda of people living with NCDs, which we'll touch upon and expand in a moment. This will be launched in plenary 1 on the 10th of December. At the forum as well, we will be launching the NCD Alliance's 2018 advocacy campaign priorities, so targeting that UN high-level meeting taking place next year. We will be sharing the NCD Civil Society Atlas, and we hope that this is going to be a very useful resource for the NCD community at large. This is an atlas that compiles the case studies that really illustrate civil society's work in the different roles of civil society in the NCD response, and so those are advocacy, accountability, access, and awareness. The highest rated case studies in each of these areas will receive a Sharjah Award for Excellence in NCD Civil Society. And finally, we're also looking at launching at the forum the practical guide on healthy workplace in low and middle income countries. There we have a flurry of social media activities planned, and for this I would like to invite my colleague Lucy Westerman to speak for a couple of minutes, please.
Hello everyone, yes, Lucy Westerman here. Can I have the next slide please so we can move through this quickly because I know there's a lot to talk through. Okay, so obviously we're thrilled to have over 300 people joining us in Sharjah, but of course there are thousands, perhaps millions around the world who can't be there and would like to be part of the discussions that take place. So social media is a critical platform to ensure that we can facilitate this and not only share what's happening in Sharjah, but also engage other people's perspectives. So we'll be most active on Twitter during the forum, but we'll also have a presence on Facebook, Instagram and LinkedIn, as will the local hosts FOCP, and you can find the links to those handles there. On all the social media platforms, please use the hashtag NCDAF 2017, and we'll also try to make sure that any other keywords and acronyms such as NCDs, NCD Voices, UNHLM, etc. are used as hashtags as well. So we've commenced sharing sessions, speaker and publication highlights, and we'll continue to do that over the next few weeks as we launch big news. We'll also publish news and blog recaps on the website. We'll be live tweeting and amplifying tweeting by delegates, and we're hoping to also live stream the 4 plenaries that to be confirmed on the ground. Next slide, please. In terms of resources, so I've got some links there that might be useful for people. In addition to the main website and the resources sections, we'll also have resources in a public folder on Dropbox, which will make it easy for access and sharing. We've also created Twitter lists of the delegates and the speakers and also youth who are attending and engaging online, which will make it easier to find them, attach handles to tweets, cite people for quotes, and also follow the respective feeds of those list members. We do have a social media toolkit coming very soon, so watch this space. We'll send it out as soon as we have it finalised. And finally, today we've launched a social media thunderclap. For those who aren't familiar, it's an online amplification method. It will complement a live commitments map that will be in Sharjah at the forum, where delegates can apply a sticker to the map. Can we go back to the previous slide, please? Thank you. Where delegates can apply a sticker to a map representing commitments that they'll make to step up the pace on fighting NCDs to make 2018 count. You can easily join the thunderclap, which will send out an automated tweet or thunderclap on the 11th of December. And by doing this, we'll also put your commitment on the commitment map. So if you haven't done a thunderclap before, please check out the thunderclap cheat sheet, which I've linked to there. And it will include tips and commitment messages and suggestions for those who want to engage. Next slide, please. Thank you. And so finally, we've got the contact details of the comms team members. Marty Logan and I will be the main points of contact for social media, so please don't hesitate to reach out to us if you have any further questions. Thank you.
Thank you, Lucy. For the sake of interest, we're going to go straight into the next presentation, and then we'll stop then for Q&A. We wanted to share with you today the Our Views, Our Voices initiative. This is an initiative of the NCD Alliance and of people living with NCDs. Next slide, please. Our Views, Our Voices is an initiative that has been launched by the NCD Alliance in response of really spotting a gap, and that is that despite NCDs affecting millions of people across the globe, advocacy efforts and policy-making processes to date have been largely devoid of these important perspectives, presence, and voices. So Our Views, Our Voices is an initiative that seeks to meaningfully involve people living with NCDs in the NCD response. It has 4 different prongs. The first one is consultation, and this is really the NCD Alliance recognizing that to meaningfully involve people living with NCDs, a continuous act of listening is important, basically. So really to involve people and ask them about their views and listen to what people have to say. So that really is at the heart of this initiative, to really be reaching out to people living with NCDs for their views. It is Our Views, Our Voices is also about it's really about advocacy. It's about using that personal lived experience to affect change. And with this initiative, we're looking at producing an advocacy agenda of people living with NCDs that crystallizes the asks and the priorities of people living with NCDs that can be promoted through advocacy efforts. As mentioned, this is all about ensuring and increasing the meaningful involvement of people living with NCDs in decision-making processes. And then finally, as part of this initiative, really it's about putting people first and giving the floor to people living with NCDs and really amplifying their views and voices in order to challenge misconceptions and break down stigma and discrimination. Next slide, please. As part of our consultation effort, this conducted over the course of this summer, we conducted an online consultation in English, Spanish, and French, through which we were able to reach nearly 1,000 people in 74 countries. At the heart of the consultation questions were: what were the main challenges faced by people living with NCDs? What are their main asks of decision makers, and how they would like to be meaningfully involved in the NCD response? In addition to the online consultation effort, we conducted community conversations. The NCD Alliance produced a guide, and this was used and implemented in 16 different countries. 72 community conversations took place. These are basically in-person discussions, a facilitated focus group, if you will, and these, of course, were provided with a facilitated with a guide of the questions for facilitation, again around challenges faced and key asks of decision makers. Through the community conversations, we've reached nearly 1,000 people in 16 countries. The consultation themes are those that form the bare bones and framework of the agenda, and those are treatment, care, and support, social justice, prevention, and meaningful involvement. Next slide, please. The next slide shows just a fantastic the diversity and really the beauty of the NCD community and the different communities that were reached in these community conversations, people living with a wide range of different NCDs. In addition, by people living with NCDs, we have included in this definition not just people living with NCDs themselves, but people that have had a diagnosis, but people that are directly affected by these diseases for instance, people, care partners, close relatives, and close friends of people living with an NCD. So this was something that we heard clearly from different individuals, that definition of people living with NCDs needed to be a little bit broader than just those that have had or had a diagnosis in the past. Next slide, please. The consultation effort has compiled a tremendous and very interesting set of data. We have produced public access interactive dashboards that are going to sit on the NCD Alliance website, through which you can interact with the data. And so we have a dashboard for the online consultation where you can, for instance, look at the results according to a particular condition or to a particular country or gender, and you can see how people of that particular subset responded to these questions. And so again, they relate to challenges and what areas they think decision makers should be dedicating more attention to. So we encourage you to access those dashboards and interact with the data. The next slide, please. In addition to the online consultation, we've also produced a dashboard for the community conversation results. Now, these were highly, they're very, very interesting set of results, and this of course is highly qualitative, and so the NCD Alliance has processed this data so that in the dashboard, again, you can look at this by country. It is possible for you to search in the dashboard for different quotes of those participants in the community conversation. So if there's a particular theme that interests you, you can just enter it in the dashboard, and that will pull out the quotes of the different participants. Both of these dashboards have been constructed with the thought in mind of really helping further the advocacy efforts of the NCD community and really bringing those quotes, those views of people living with NCDs to the front. So we really encourage you to interact with these, and these will be available in the website of the NCD Alliance in the next later this week. Next slide, please. With this tremendous amount of data to hand, a draft advocacy agenda of people living with NCDs was produced, and this was finalized at a workshop that took place in Geneva at the end of October, where we convened 34 people living with NCDs from 22 different countries. And this was a tremendous experience. We brought together people living with an enormous variety of living with different conditions, and again, people that have had a diagnosis themselves, and people that have experience as care partners or as parents of a child living with an NCD as well. Which brings us to my next slide, which is the advocacy agenda of people living with NCDs. This will be launched at the Global NCD Alliance Forum. It draws from the input of nearly 2,000 people from 76 countries. It is an extremely powerful document, and we're very much looking forward to sharing this with the NCD community when it gets launched at the forum. What makes it extremely powerful is that it crystallizes the asks of those directly affected by NCDs. It includes it covers the 4 different areas: human rights, social justice, prevention, treatment, care and support, and meaningful involvement. It includes those specific asks of decision makers, but it really frames why action on these different areas matter to people living with NCDs. It is to be used as a reference by the NCD community to guide us in our advocacy efforts and to really make the case for the NCD response and decision making and policy making to put people first and to meaningfully involve people living with NCDs throughout the process at all levels: national, regional, global, in advocacy efforts and in policy and decision making itself. The prime opportunity for us to put this advocacy agenda into action and to be calling for the meaningful involvement of people living with NCDs, of course, is at the 2018 UN high-level meeting next year. Next slide, please. We have produced a series of micro-documentaries really highlighting the lived experience and really bringing that advocacy agenda to life. And again, these will be released during the course of the Global NCD Alliance Forum, so please look out for those. And then finally, next slide is really about looking ahead. The consultation effort conducted this year has provided us with a tremendous foundation for programs to really push and call for the meaningful involvement of people living with NCDs. And so we are looking at mobilizing a group of people living with NCDs, offering them opportunities for involvement, developing a training program. We're working with colleagues at the WHO Global Coordination Mechanism on a community of practice for the meaningful involvement of people living with NCDs. And again, the 2018 UN high-level meeting itself, where we would really very much like to see people living with NCDs directly involved at the meeting. I just wanted to finalize the presentation on our views, our voices, saying that this work would not have been possible without the tremendous contributions of people living with NCDs themselves, the different national and regional NCD alliances, and really the NCD community that has participated and promoted our consultation efforts. Without your help, this would not have been possible. The effort is also possible thanks to the supporters of the NCD Alliance. And I just need to highlight Medtronic Philanthropy, who supported the consultation effort, as well as Novo Nordisk, that supported the consultation effort that took place in East Africa. So we very much look forward to share the advocacy agenda of people living with NCDs with you at the Global NCD Alliance Forum, and to unfold this initiative in 2018. Over to you, Katie.
Thanks, Christina. Great to see the obviously all of the great activities and products coming out of Our Views, Our Voices. This is a whole new focus for NCDA, and something that we're really passionate about, and really pleased to see so many kind of strong messages and strong advocacy asks coming out of these initiatives. And just to kind of flag that, really for those not coming to Sharjah, obviously the advocacy agenda for people living with NCDs will be uploaded on our website, so it will be available. And then, as Christina has highlighted, we've got a whole, phase 2 of Our Views, Our Voices that will be continuing next year, and it will be really important that advocates at the country level are thinking about how you can then adapt it and translate it to your national context. So much more to come in terms of Our Views, Our Voices. Thanks, Christina. Let's move on to the last slide of the webinar, which is just a very quick overview of what's to come in the first few months of 2018. Obviously 2018 is going to be an extremely busy year for the NCD community, with the high-level meeting hopefully in September. And so a lot of these events early on in the year will be quite instrumental in helping shape that high-level meeting. So just to run through a few of these that you'll probably all be familiar with anyway. Obviously January is a busy month with the WHO Executive Board on the 22nd to the 27th. And at the Executive Board, obviously the general program of work that Elena was presenting on earlier will be being discussed, as well as obviously NCDs being an important agenda item with the high-level meeting in there as well as other important elements like the Global Action Plan on Physical Activity that's currently being developed. So there'll be a lot of NCD-related agenda items being discussed at the EB. Obviously, during that same week, we always have the same old challenge that the World Economic Forum's Davos meeting happens within a similar time frame, and obviously in previous years, global health and NCDs have been a major focus for Davos. So we're hopeful that will be the case next year as well. And then also in January, as Priya mentioned earlier in her presentation, that's when we're anticipating the modalities resolution negotiations for the high-level meeting to be taking place in New York. So a critical window of opportunity to be influencing how that meeting will be panning out. February, obviously, annual World Cancer Day on the 4th, as well as later on in the month, the World Urban Forum, which is another great opportunity to be building synergies and collaboration with the environment community, building upon Maria's presentation earlier. March, we have on the 7th to the 9th the World Conference on Tobacco or Health, which will be taking place in Cape Town next year. And again, there'll be many NCD-focused sessions at the World Conference on Tobacco or Health. Also in March, we'll have the annual UN Commission on the Status of Women, which again, many of us really try to leverage to build synergies with the women and children's health community. So it's a really good opportunity in the lead up to the high-level meeting to be leveraging those partnerships and those relationships. April will be an extremely busy month, not only because we're nearing the World Health Assembly, but also because of the NCD Financing Conference that will be taking place in Copenhagen, co-organized by WHO and Denmark, DANIDA. So a great opportunity to be really focusing in on issues around financing across domestic resource mobilization, development aid, and public-private partnerships, and really trying to focus the community around some really specific solutions and mechanisms for moving this really important bottleneck in the NCD response forward. Also in April, there will be the first WHO Global Coordination Mechanism General Meeting. The host country is still to be confirmed, but this will be the first time that the GCM is organizing a general meeting. and it will be a meeting for all participants of the GCM. And no doubt it will have a strong focus on the high-level meeting that will be taking place later that year. In May, again a busy month, we'll see the launch of the report of the WHO High-Level Commission on NCDs. As Priya mentioned, or Elena mentioned earlier, this is the commission co-chaired by Sanya Nishta and Dr. Tabare Vasquez from Uruguay. And that report will be really important in setting the bar very high in terms of what we want to come out of the high-level meeting. That's our hope anyway. And then obviously later on in May we'll have the World Health Assembly, which again will be a critical point for both the general programme of work being adopted, but also, as I mentioned earlier, related to the EB, a number of really important NCD agenda items on the table for the World Health Assembly. So that's just a very quick whistle-stop tour of some of the key milestones at the beginning of 2018, and a lot more to come in terms of NCD Alliance's advocacy priorities and plans for next year. But this will be the last webinar of 2017 for us. We're planning to have our next webinar early in the new year, where we'll be going into a lot more detail of 2018 and the year ahead. So let me end there, and let me thank all of our speakers for today's presentations, particularly our guest speakers from WHO, and wish you all a good rest of your year, and we will be updating you in the new year on deliberations from the forum and plans for 2018. Thank you, everyone. Goodbye.
Today's call. Thank you for your participation. You may now disconnect.